Hello, everyone. Thanks for tuning in to join our COVID-19 information and a myth-busting session. I'm very excited to be here. We're so glad you're joining us today, and I really want to thank Morley College for sharing this talk as part of their Penny Lecture Series. My name is Natalia Clifford. I'm a Deputy Director of Public Health across the boroughs, that's Kensington and Chelsea and Westminster. And I'm joined here by Jess. A very warm welcome. Do you want to say hello?
Hi, my name's Jess. I'm a trainee GP working in Hammersmith at the moment. Over to you, Natalia.
Lovely. So today's chat is all about coronavirus and the vaccine. And I know that we're all a bit over talking about coronavirus and COVID-19, but we're here to answer some questions that have been asked by young people locally at Morley College, but also around Kensington and Chelsea. And this is all about hopefully making you feel more clued up about the virus and informed about taking the vaccine.
Yeah, and just to say thanks to everyone who asked a question or shared a concern. But if you didn't get a chance to ask a question, we don't cover it in the chat, then we'll be letting you know later on some more information about how to get in touch. So Natalia, I guess starting kind of back to the basics, what is COVID-19?
Yeah, so COVID-19, it stands for coronavirus 19, and it's a coronavirus, it's a type of coronavirus, and it's corona because it looks like a crown if you look under a microscope, and it's 19 because it was discovered in 2019, and it's a really infectious disease discovered in China, as I said, in December 2019, and it's hence spread all over the world, causing huge amounts of disruption and all the social isolation rules that we're having to follow for the last 18 months. And it's mainly spread through close contact with someone, and that's normally through an infected person who is coughing, sneezing, so particles of the virus being breathed in by somebody else.
And how dangerous is COVID-19 for young people?
So thankfully, the virus doesn't affect young people as badly as it affects other people, which is absolutely fantastic. But the danger of the virus is that it's highly infectious. The young people can pick up the virus without knowing it, can spread it to other more vulnerable groups or to the older people who can unfortunately have more severe symptoms. But also young people themselves, if you've already got pre-existing health conditions, respiratory conditions like asthma, can be really affected by getting coronavirus.
Okay. And I know we've been hearing a lot in the news recently about all these new variants. What exactly is a new variant? How many are there?
Yeah, so it's a coronavirus, and it's a virus that's really, really good at mutating, and there are loads of variants, and potentially hundreds, even thousands of variants will come to pass. So it's changing all the time. The big variant that we've got at the moment in the UK is called the Delta variant. We're seeing in India there's now the Delta Plus variant, and it seems to be highly transmissible. That means it passes really quickly to other people. And viruses are really good at changing and mutating to adapt. So it's basically to survive. So we see that, and more it passes on, it changes more and more to get quicker and more efficient at infecting other people. Yeah.
And I know a lot of us are getting a little bit annoyed at always having to follow all these rules. So why do we have to keep following the rules when actually most of the country are now vaccinated or maybe immune from having caught the virus themselves?
Yeah, so what we know about coronavirus is that it's really unpredictable. As I said, it's changing, adapting all the time, and the ways that it's changing aren't always immediately clear. So the vaccine is shown to be really brilliant and extremely effective against hospitalization, so against people getting really unwell. But we know that as new variants emerge, people are still getting the coronavirus and still passing it all the time. And it's really, really important that we're in this kind of crucial bit before we've got enough vaccines in people's arms that we continue to support that hand-safe space, be restrictive in terms of how we're moving about to protect everybody. Because as I said, we can still pass it on really, really easily, and those most vulnerable will still unfortunately be badly impacted.
Thanks, that's been really helpful.
Yeah, but as I've said, young people are less likely to get ill, But there are a few more questions I've got for you, Jess, if that's okay.
Okay.
So as a young person, as I said, if you are less likely to get ill, why do I still need to take the vaccine?
So a national vaccine programme will only work if the majority of the country get jabbed. So even if you probably wouldn't get seriously ill from COVID-19, if you get the virus, you could still then be infected and pass it on to someone who may not be as able as you are to fight and beat the virus. And Natalia, as you've already said, if you get the vaccine, you can actually feel, if you get the virus and you get COVID-19, it can make you feel pretty rubbish. So it's another reason to avoid that by getting the vaccine.
Thank you. But how about I'm worried about the vaccine and what effect it might have on my body? Can you tell me a bit more about that?
So that's understandable, but actually the vaccine has been proven to be safe. To have a few side effects after the vaccine is normal and expected, and is just your body learning how to be immune to COVID. And that mild usually and only lasts a couple of days. Now, there has been very, very rare cases in young people of there being blood clots, but that is so rare. We're thinking about 4 in a million people. But because of this, the AstraZeneca vaccine is now not being used in young people. Instead, we're using the Pfizer vaccine on alternatives. And with the Pfizer vaccine, there has not been shown to be any risk of blood clots.
That's brilliant. That's really good. So basically, if we're young, take the Pfizer vaccine or even the Moderna vaccine if we're offered it as well. That's really, really helpful. So I've heard some, as you said, like some people say they feel a bit ill after the vaccine. Is there anything we can do to avoid that?
Yeah, so it is possible that you might feel slightly unwell afterwards. But like I said before, it should be very mild. If you have a little bit of a fever or a sore arm or a headache, as long as you're not allergic, it should be fine to take something like paracetamol, just to make yourself feel a little bit better. If you're worried about any of the side effects at all, you can always speak to your GP. There are a few tips about how to avoid feeling unwell in the first place and being maybe one of those lucky few that have no side effects at all. And that's making sure you're very well hydrated before you have the vaccine, having a good meal the night before, and please, if you can avoid it, try not to be hungover on the day of the vaccine, because that can make it much more likely for you to get side effects.
That's a really good tip. So no hungover vaccine shots in the morning. That's really helpful. Thank you so much. So there has been a bit of chat around the long-term effects of the vaccine that we don't know about yet. Can you tell me a bit about that?
Yeah, so we're actually now on day 200 of the vaccine. So that's over 6 months. So that's a really good amount of time has passed since the first jab. And as far as we know so far on the data, there's not been any long-term negative consequences of the vaccine. In addition to that, even though the vaccine itself is new, the technologies and the knowledge and the expertise that have been used to make it has been around for a much longer time, and it's been used to develop lots of vaccines which we know about and we've been using safely for a long time.
And I've heard a lot in the news about specifically like around BAME communities and if there's difference for vaccines and their effects. So can you share, what is the evidence showing that the vaccine is safe for BAME community?
So yeah, we understand there have been concerns from Black and minority ethnic groups about the vaccine, and that's completely understandable. When the trials were done, they were representative of the different ethnic groups in the community in the country. So that means that there were people representing the different ethnic groups. And the trial data showed that there was no kind of negative effects in one ethnic group over the other. So yeah, basically, as with any ethnic group, the benefits of the vaccine have been shown to outweigh the risks in all the ethnic groups.
That's really helpful, thank you. And we'll post some links online afterwards in terms of where you can find out more information from trusted sources on that. Thank you.
So to ask a few more questions for you, if that's okay, Natalia.
Go for it.
So despite everything that we've been talking about, if I was still to not feel confident in getting the vaccine, can I wait?
So yeah, I mean, it's really important that we do all get vaccinated as soon as possible. And actually, there's a campaign at the moment for the summer. It's called the Vaccine Sprint to try and get everyone vaccinated. Certainly for young people, first dose in their arms before the 19th of July. So when we come out of lockdown, we've got as many of us vaccinated as possible. But you know, if you are still have some more research that you want to do, there will be loads of opportunities to get vaccines in the future and book yours when you feel ready to.
And I know some of us feel like these lockdown rules have just gone on a little bit too long. And we can't really see why it should still be limiting our lives. What are your thoughts on that?
Yeah, so the rules have been really, really tough and they've been going on for a really, really long time. So I definitely can relate to that and understand what that's like. And I think the vaccine really is the last hurdle to being able just to live a kind of new normal life. And so I think, yeah, it's really impacted our freedom and how we can move and who we can see and separate us from our family and loved ones. But as I said, this last push towards the 19th of July, we've got to get as many vaccines done as possible so that we can live, as I said, a more normal life, mixing and being with our friends and loved ones and being able to travel and you know go to work and things like that. So you've already done so much, and actually I think young people have really paid like some of the highest price to following the rules, and I just really want to thank everybody for their part in that and all the sacrifices everyone's made. But it really only takes one person to break the rules, the restrictions, and then you can really quickly pass the virus on, like and then to hit people that are you know more vulnerable and have serious effects on their lives. So we've really got to keep going for as long as possible and hopefully get to the end of summer. We might all be vaccinated and be able to live our lives.
Thanks for that. I know that a lot of people feel that maybe they've been lied to over the last 18 months, and they no longer trust the advice that's coming from public health or from the government. What would you say to people that feel like that?
Yeah, well, I think that's quite understandable. And I think the issue is that when you're, public health have been able to only give the advice and guidance it can give with the information it has at any time. And the things about working in a pandemic with a new virus, we don't always understand how it works. And as I said, it adapts and mutates all the time. So we can only give advice and guidance on what we think is the most effective at that point in time. And then information changes. We learn more from trial data, from data in the widest sense as well. So it's definitely frustrating when guidance changes. And virus will continue to change and adapt, and guidance will continue to change. But I think we have to feel confident that we're in such a better position than we've ever been before. We've got an effective vaccine, and we just need to take the uptake when you're eligible, and hopefully we're moving towards a more safer society, safer community where all of us can move freely.
So Natalia, you've convinced me, and I want to get my COVID vaccine done. How do I book it in?
Yes, there's two main ways. You can book online or call 119. We'll put the links below. And anyone over 18 years old is eligible for a vaccine. And you don't even have to be registered with a GP, though it is preferable. There's lots of ways of getting a vaccine. And yeah, we'll put links below and go grab a jab.